Okay, going live. Hi, Yehudis Schamroth here from RBS Acupuncture in Ramat Beit Shemesh, Israel, the nurse that does acupuncture. Today is a very interesting topic to me because many people ask me what they don't realize that acupuncture and Chinese medicine is appropriate for children. And so we want to discuss that today and how and when to choose a practitioner and how and when to utilize Chinese medicine for your child and your children. You should know you can be preventative and you can be proactive about this. It's not a new science. Chinese medicine has been around for lots and lots of years. So I'm going to discuss all that with you. And before I get straight into the topic itself, I just want to remind you that I can be reached at rbsacupuncture.com. And also rbsacupuncture@gmail.com. I have a website and I have a email. Email me anytime or you can write to me in the sidebar. Okay. I have a healthy eating group. It's a WhatsApp group, and I am going to look for the link when I have a free moment to look over at that page so I can share that too if anybody's interested. I've got people from all over the world asking questions, and it's just a quick blog or two every week talking about healthy topics and healthy eating. I've been on a series of eating for different organ systems, according to Western and Chinese medicine. If you know me by now, I'd like to put those two together because if you know enough about Chinese medicine and you know enough about Western medicine, there are really no contradictions at all. Okay, so even healthy children are extremely vulnerable to illnesses. And especially now, we know with viruses, allergies, illnesses, because like respiratory stuff, because it's winter, getting headed toward winter time. And of course, with the COVID coronaviruses and everything, people are very much aware of respiratory stuff, bacterial stuff, and viral stuff. We all know for now, a long time now, that bacteria can become resistant to antibiotics. And when this form of medicine is overdiagnosed, it becomes way too common, and it happens that way. Although I'm proud to say that my pediatrician and now my granddaughter's pediatrician, who is the same man, Dr. Singer at Beit Shemesh, he is very cautious about prescribing antibiotics. And I think it's great because, the body just becomes resistant to it. And then kids especially are much more vulnerable to this. It happens so often that Western and traditional Chinese medicine doctors are trying to combine efforts to educate the public about the problems and with and the misuse of antibiotics, as well as valuable alternatives. Children are some of the patients that are most susceptible to the stronger, more resistant strains, by the way. So just to mention too, among the alternatives to antibiotics in Chinese medicine, a gentler, more subtler approach is used for children and adults, by the way. I talk about that very often. Chinese herbal therapy. Chinese herbs are an amazing way to nourish the child's body, to eradicate the disease, to build up their strength and their immunity. And we can try to give it in a form that's tasty for them. Although, we all know that Chinese medicine always has that strong smell, and very often the plants are extracted from the active ingredients are extracted from the plant with the use of alcohol. So that's not going to happen for children. We're not giving it alcohol. But we do know that we can give the kids herbal medicines in other forms, like, in oils, in olive oil. They can extract them in honey. That's another way of preparing herbal medicines for kids, especially. And we also know that they're making gummies now that, things that kids will take to get rid of their infections as well as build up their immunity. So I wanted to just talk a little bit about what is Chinese medicine anyway, because it really is a topic that it's near and dear to my heart, obviously, because I'm really very much a big believer. I wasn't always, by the way. I have been always, for years and years, just a straight up Western practitioner, nurse anesthetist, drugs and surgery and drugs. But I always wondered, what else can we do to help people? Why can't they all get well with chronic illnesses or recurring illnesses or just regular colds and flus? If people are going to demand to get medication every time they walk in the doctor's office, some doctors will buckle to that pressure. But the truth is that, it's not a good idea to always be on drugs. It just isn't. And I think this is my 4th week now. I'm saying that the best medicine is no medicine. So it's not always possible. We need medications. We need antibiotics. We do need heart medicines. We need our asthma medicines. We need all those things that save lives over and over every single day all over the world. However, there are some misuses going on. So we want to make sure we can deal with that and try to, take care of our kids more naturally. Again, I was not always an earth mother. I didn't do that. My kids ended up with tubes in their ears and antibiotics on and off. It was so frustrating. But if I had known then, 20 years ago, what I know now, I would have given my kids way different treatment and probably kept them a little. My kids were healthy, thank goodness. My pediatrician hardly knew who they were. That's always amazing. But I can tell you that the kids really, they didn't suffer a lot with respiratory colds. And, it's inevitable when they go to school. They're going to go to school. They're going to go to their daycare centers. And the kids are just passing around and around and around. And there's really not a lot you can do about it sometimes. But it is something we can be aware of and try to prepare them in a more of a preventative way. So what is traditional Chinese medicine? We call it TCM. It's a style of Chinese medicine that was taught about 4,000 years ago or something. It was so old and so ancient. But fast forward to today, the Chinese medical concepts of treating people according to season and according to their bodies' needs and illnesses that they're predisposed to. We talked about this one week, that people have constitutions that are very different from each other. So if you start off with a very weak constitution, you are going to be a setup, or you're going to be a person who's going to be getting sick more frequently, or needing glasses more often, changing of your prescription, or visits to the doctors. It's just one of those things. You can't help. It just, you're born with certain things, propensity for certain things. But in any case, we want to know, how does this Chinese medicine work and what does it do? And how does it work for Westerners? Like, why is a person like me, I don't look Chinese? I'm not. I wasn't even taught by Chinese people until I was already finished with my program, with my educational program, when Chinese practitioners started coming to Israel. And so I had the good fortune of being taught by a few really amazing human beings and medical practitioners that were also Chinese medicine practitioners. They were doctors as well as Chinese medicine doctors, Western and Chinese in one, or Chinese medical trained, but they happen to be Chinese, also Taiwanese and a couple of other different Asian flavors, but they're authentic. But thank God I was able to be taught by some of them so I could pass that on to my patients. So what's wrong with Western medicine anyway? Well, really, there's nothing wrong with it. We need it. Western medicine has done some very wonderful things for us. We know that doctors feel very patients feel very confident going to doctors, and especially, again, as I mentioned, with serious health problems or epidemics like we've been going through, pandemics. We have to have our doctors. Please don't get rid of them. I could refer back to my YouTube channel to hear my interview by Dr. Simcha Shapiro, who lives here in Ramat Beit Shemesh, he practices a blend of Western and Eastern medicine, and he's a big believer that you need to trust your doctor and you need to go to work together on your healthcare plan. So don't forget your doctors and don't discard them at all. That's just my opinion. But we know that Chinese medicine is the oldest continuously practiced literate and professional medicine in the whole world. And at one time it was used by 1/4 of the world's population, but and now I think it's becoming back in favor to Western countries, because we know that we can't do everything with surgery and medicines. We need to look out for something else, and we want something more natural. So traditional Chinese medicine looks at your constitution. We do an evaluation to see not only what your symptoms are, but we want to look at your weaknesses and your excesses in your body. Chinese medicine says, are you weak or are you excessive? Those are the two basic concepts. And then we're looking for patterns in your symptoms. So even though you might have migraines and then you also might have foot pain, you think, well, there's nothing related there, that there actually could be something related there, because we do an in-depth interview on all the different organ systems. What do you eat? How do you sleep? What are your family relationships like? We do a palpation of the body. We look at your tongue. We look at your pulses. We do a lot of more in-depth evaluation, and then we come up with an idea of how you might have ended up with a series of symptoms. With kids, though, I want to just stick to kids. We'll do TCM another time. But kids are pretty much already born with weakened states. This is what Chinese medicine says. Chinese medicine says that kids are already in the weakened state. And they're born because they're just not fully developed yet. And then depending on how they're born, if they had an easy birth or a difficult birth, were they nursed? Were they not nursed? because as we know, breast milk is the most amazing food on the planet for a newborn baby, and maybe for others too. We haven't decided yet. But we know the kids don't get their proper immunity if they're not breastfed. And we know that if they have a difficult birth, not just C-section, that could be actually easy on the baby. But someone just told me yesterday that if the baby doesn't go down the birth canal, that whole process of going down the birth canal, they come out, that squeezing and that wiggling that goes on as somebody comes down the birth canal as the child is born, is a setup for putting a blueprint in the brain to learn how to calm oneself down when they're over anxious. And she said the children who have difficulties going down the birth canal and are yanked out, or the children who are outborn by C-section, are the most likely to have ADHD. Can't sit still because they don't know how to calm themselves. It's just a very interesting concept. That's also a Chinese medicine concept as well. So we know they're born at a little bit of a disadvantage because they're just not strong, even if they're the healthiest babies. So we do know that they need time for their lungs and all their organs to develop. So this is why kids are such a setup for respiratory problems, for all kinds of colds and flus, and they transmit it to each other every day. Their immune system is not great either when they're born, even if they are breastfed. So they have more coughs, more colds, more allergies, more asthma than adults do. They just do. And we do know, though, that children also have more colic, vomiting, diarrhea. That's a whole other topic. We could do days on how to feed a child and how to introduce foods to the baby and how to take care of chronic constipation. Those are things that actually we can take care of in Chinese medicine. And there's much more natural for the children than the traditional choices, which are antibiotics and let's say in the case of gastrointestinal stuff, no medications at all. We can take care of it with some little bit of acupuncture, some massage, some nice tasting medicine for them to strengthen their stomachs and their spleens, because the Chinese medicine says kids have weak spleens, stomachs, and kidneys. This is true, and lungs to some extent. So the way that they eat and drink is just a very, very important to pay attention to, which is not a Chinese medicine concept. It should be just common sense to everybody that the diet is what we need to pay attention to for everybody, but especially kids, because otherwise they're again big setups for phlegm development and colic, diarrhea, vomiting, all the things that we hate to see our poor children go through. We know that if we feed them foods that are damp, for instance, this is common knowledge. If we feed them a lot of dairy, I'm not against dairy at all. I just think that it produces a lot of phlegm in the body, and this is something to really stay away from with kids. So a lot of it's preventative. You want to give them healthy, vitamin-rich foods and soups and get them nourished. And so you can decrease any inflammation in the body with just a plain diet of gently cooked vegetables, and you can get rid of a lot of pathogens by just taking natural antibiotics. Like we do this with adults too. There's garlic, which kids probably don't love, but there's all kinds of kitchen herbs that we can use. Lemon, ginger, garlic, thyme, all the oreganos, all those things. You can spice up your foods a little bit, improve their digestion, mint, all those different things. So for Chinese dietary therapy, it's a whole study unto itself. But, we do know that it's a good thing to start off with breast milk, first of all, and then introduce them to food slowly. And we do want to make sure just a couple basics also. We want them to chew properly, chew their foods properly, digest it properly. Make sure that they have a BM every day, and make sure if it's diarrhea, don't let them get dehydrated. Make sure they have a lot of Pedialyte they sell in America. There are the equivalent products here in Israel. You can want to replace the electrolytes for your child. I think they're selling Gatorade here now, and kids like that. So if you find your kid has got a high fever and is sweating a lot, or is you have a lot of diarrhea, vomiting, make sure you replace those fluids to prevent dehydration, and also to put those electrolytes back into the system. So you want to cook things gently. You want to give them nutritious vegetables, nothing in a package, which how can you do that, right? Try that. I tried that when my kids were young. It didn't work. Now I can get away with not buying packaged foods, but when they were little, it was very difficult not to pick up a package of chips or a package of cookies and put it in their lunches. It was what we did. But it does cause all kinds of difficulties in their digestions if they're eating chemicals from preservatives put in these packaged foods, and not to mention all the high sugar that it gets them addicted to. My daughter, who I can't believe I'm bragging about her because she does that. She's got taken me one step. I'm embarrassed that she's doing what I should have done. She's got a 1-year-old baby, and she makes her cookies that are made purely from dates and peanut butter. And the baby loves them, and they're really good. They took her a few minutes to make. no preservatives, no additives. It's a cookie. It's what the kids want in their hand, and one in each hand usually. So just knowing that you can make healthy products without going, breaking the bank or without taking too much of your precious time. Okay, what I want to do is just discuss a little bit more about what I do for children and what most Chinese medicine practitioners can do to help you. Okay, share this. All right. So we're talking Chinese medicine and acupuncture for kids. Okay. So I was talking before about how Chinese herbal remedies, we'll talk about that. They're effective because they're prescribed individually. So that's another thing about Chinese herbals is that you don't give like a one size fits all. You can tailor make your formula to your child, and also this applies to adults as well. Children are more responsive to acupuncture and herbs than adults are. It's just the findings that people are coming up with. And we do know, I will talk about this in a minute, that acupuncture is not for every child. Every child will not tolerate it. And there are some kids that love it. I have kids who flop themselves on my bed and then put their hand out like this, and they say, give me my acupuncture. They can do it, and they're little. So it just depends on how much they trust you, how much they trust their parents, and what kind of pain tolerance or fears they have. So we don't have to use acupuncture, but I put that in my title because I want it to be a little bit eye-catching. So we do know that Chinese medicine children are very responsive to it. I saw this in regular Western medicine too, by the way. The kids can be very, very sick, and like you're thinking, wow, what's going to be with this kid? And then suddenly they bounce back. Kids are very resilient. So if you help them with their colds, their ear infections, their allergies, their skin problems, eczema, all those things can be treated with Chinese medicine and acupuncture, and they can have very few treatments and they need very little medication as well. But you want to do it quickly so the kids can really bounce back because they're really able to. There are different types of acupuncture. I'm going to talk about that later. Let me see what's next on my schedule here. Oh, I don't have this. Let's see if I put it here. There we go. Okay, what do you want to know about acupuncture and Chinese medicine for kids? I'm going to go into these in a little bit more detail. Babies less than 6 months can be treated with acupuncture and herbs. These are all truths. These are, if you heard otherwise, it's a myth. So here are the truths, according to Yehudis. But I've done a lot of research, and I do it myself every day. I have a lot of pediatric patients who love me and trust me. And the last kid that was in my office came in for a ganglion cyst on his wrist, and he's 9 years old or 10. And he told his mother that Mrs. Schamroth is really, really nice. And he let me give him acupuncture too. And he says it's going away already. He's on his wrist. He needs a few more treatments. So Tuina is a type of massage. It's kind of twisting and pulling. It can be severe, but it can be gentle for children. Pediatric massage is a non-invasive way. It's a non-invasive way to treat problems and improve immunity. And I forgot to put up there that also reflexology is also amazing for adults and children. Non-invasive. So acupuncture in children, I'm going to discuss that in a little bit. Common illnesses that we can treat. I just mentioned many of them. Most of them are respiratory, but they're also skin and digestive. This is what we see a lot of: skin, digestive, respiratory, and we can do a lot about prevention and a lot about treatment. And then there are those other things too, like ADHD that I mentioned. Also, like that little boy that came to my office yesterday. We gave, I gave acupuncture for his ganglion cyst. Back pain. There are things that kids come with. They're the growing pains, all kinds of things. And their parents bring them to me because they've been to me themselves mostly. And they're not afraid of Western medicine, but they just will try to take the alternative route first. And that's a whole turnaround in thinking these days. And I know for sure it's a turnaround in my thinking that I always did medicine, surgery, medicine. And if it didn't work, I would try something alternative. And of course, over the years, I've flipped on that. And I would, unless it's an emergency, real true a medical emergency, which I mentioned down here, TCM, traditional Chinese medicine, is really usually not suitable for emergencies. If I was stuck in an airplane with somebody and they were having a heart attack, I know what needles that would help them with their chest pain, but I certainly would never stick with that if they were in my home or on the street. I would call the ambulance right away and get them right to the doctor with an asthma attack, with dehydration, with chest pains, with seizures. There's a lot of... There are things you're just not going to say, let me give you a needle here, sir or miss or baby. You're going to get that child or that adult right to the hospital as soon as possible. So most common illnesses and other unusual things as well. TCM, I meant to put herbs, I put hers. Herbs, or herbs, as my husband would say. He's from South Africa. He says herbs. they complement Western medicine. So this is what you should know: is that don't be afraid. If your child is already on a medication, let's say for seizures or something, or for asthma, or even for antibiotic for something, because again, we're not going to remove antibiotics from the world. We're just going to be more cautious about how we use them, so we don't wipe out the body's immune system and their microbiome. So keep your child on, and again, keep yourself or your child on your Western medicines and your Western medical protocols. There's no reason to stop. You can do them both together. So people say to me, I want to go to my doctor first before I come to you. I want to see what's really going on. That is an amazing idea, and I encourage that 100%. Get tested, and with the kids too. If you think your kid has a broken arm, please go to the emergency room. If you already know that this child just has a sprain in their ankle or their arm, then bring them to me. But make sure you know what you're dealing with first, because I'm not going to be in a position to help you with emergencies necessarily. Even though I've been trained in anesthesia, I don't have my equipment anymore. I don't have breathing tubes, and I don't have medications anymore with me in my home. So I will not be able to help you. But please just go straight to the emergency room, and we'll see you when the baby's calmed down from the asthma, or the baby's calmed down from the leg has been set, a broken leg, broken arm. I can treat the pain then. I can take the swelling down then. I can do that. But, anything emergent, please go to the emergency room to your doctor. Okay, we do know that traditional Chinese medicine builds immunity. It builds immunity by stimulating the body to give its own immune system a boost. And you can do that by massage along the back, which I'll talk about in a minute. Also with Chinese medicine and herbs. Okay, so let me go on to the next group here. So again, I mentioned children of all ages come to me, and they can be treated with Chinese medicine. So we do know that TCM builds up immunity. It's a good strategy to have for maintaining a child's good health. So others use traditional medicine as a complement to Western medicine, like I said, when kids have a poor appetite, or they have gastroenteritis, or the common flu, like this little girl, chronic cough and allergic rhinitis. So we do say, let's say they went to the Western doctor and he said, here's your antibiotic, fine, because the child had an infection or nose. You can't mess around with infections either, because it's a catch-22. If you have a strep throat, you want that child on an antibiotic, because it can develop to what they call myocarditis. If you have an infection that travels through the body, it'll hit the lungs and the heart first. It's a terrible thing. You don't want to set up a child for cardiac issues the rest of his or her life, just because you don't want to give them an antibiotic for strep throat. Now, there are a lot of other things you can do, but if you can get kids to eat garlic and oregano and all that stuff, it's really difficult. I think I mentioned a few times, I have a nephew who was always who do demonstrations for me when I would do healthy eating and winter wellness sessions, and chop up garlic, stick it on a spoon, real finely chopped, like 2 cloves of garlic, and then pour some very big helping of organic honey on it, and have the child swallow that. And not every kid will do that. I had a little child, my nephew, he would do it for me as a demonstration to how kids can do it. But it's not easy to have every kid do that. So you just have to know you do need once in a while those antibiotics. Just get that cleared up, that ear infection cleared up, or get whatever, and then try not to go back on them anymore in the winter. So this is where we can build the immunity up. We can give there's natural drops we can put that are made with olive oil and garlic and things like that can really, really help. That you don't have to go be running and turning to your doctor for steroids and antibiotics all the time. But again, if you feel like it's something that will just put things to rest once and for all in terms of your illnesses, or even if you do need surgery, please don't blame yourself. Don't be a guilty parent. Don't say I'm a bad parent because I'm using an antibiotic, but just be judicious about it, and just make sure that, if it comes up more than 3 times in a year, there's a problem there. You need to get that baby or that child's immunity build up better in a more natural way. Okay. So we do know it's a complement to Western medicine, but you should inform your doctor if you're taking some herbal medicines for your kids or giving them some medicines, and inform your Eastern practitioner as well. Tell them what you're doing Western-wise, so everybody's on the same page, because that is, by the way, newsflash, the true holistic medicine. We're living in a society now. It's not like Chinese medicine back in the 2,000 years ago. We're living in a time now. It's a much more pressured and stressed time. We're exposed to so much more damaging stuff for our bodies, including, pollutants, and all kinds of things and additives to our foods, and stress in our lives, and viruses floating around. We have to use both now. Maybe that's what God intended. Maybe that we can't change in one for the other. We have to learn how to use them together. So there's a myth out there that children won't take your herbs. Okay, it's not true. Many medicines can become in powder form. They can be easily dissolved. They're liquids. Plants have an affinity for different parts of the body. So let's say there are plants that are good for lung health, strengthen the lungs. There are plants that are good for brain health and calming. You can give, there's essential oils out there too. People are onto this now. Lavender, spritzing in a room is lavender you can use on your skin on an insect bite, which is amazing. It's very healing. So for your kids, instead of having to reach for like a caustic chemical, you can also make sprays, insect sprays with these essential oils, so you don't put any chemicals on your kids' skin. And also, you can make sunscreens too. We'll do that in another program. Because if you want to really be very healthy and natural with your kids, you could do it right from in every aspect of your lives. Again, unless it's an emergency. Okay, so we can make herbal medicines taste very, very good for kids. Here's the massage I told you about. Massage and Tuina. Tuina is a little bit more of an intense massage, but I teach parents every day how to do massages, and there's a certain technique too. It's a type of acupuncture, but I'll talk about that in a minute. It's called Shoni Shin, and it's really not. It's a non-acupuncture for kids, because I use a series of tools that are like little tiny, like this big, like an inch big. They look like a little rake, and you just gently, or even like a little, looks like a little spatula. We know exactly where to rub it down the body. The meridians, which go to the different organ systems. We have lung meridian. We have 12. We have lung meridians, and we have stomach and liver. Everything's attached to an organ, and we access these organs from the outside. And so when we rub them in a certain way, it stimulates the organ for healing and get blood flowing and decreasing inflammation. Well, it's all really a brain treatment. That's what I always say, because the brain is the master control center of your body anyway. So we are setting up with acupuncture and herbal medicines the idea in your child's brain and in your own brain, if you're being treated, to heal the body, because the body does have the ability to do so. Okay, so the massage is a very good thing. And let's see, I wrote something about that. I want to say more about the massage. Massage is something that every child loves. We can teach the parents how to do it. I sometimes have one visit with people because they don't come back again after I show them that massage. But it also gives the kids and the parents a real good bonding time together. Maybe before they go to sleep, you can do it yourself too. Have the baby or the child lay on the tummy like this, just for anything, and especially building immunity. You want to just rub up and down along the spine with your hands, or gently massage with a little bit of a pinch pull down stuff from the top bottom with both hands on either side of the just pinch pull, pinch pull, pinch pull. I'll do a demonstration one day. Just doing that alone will put your kid to sleep very nicely. It will build up the immune system, because all the innervating nerves come from the brain and spinal cord. It goes around the body, just like in Western medicine. Anatomy is anatomy. You start here on the neck and you go all the way down and massage, push, just massaging like that. Children will feel great. You will be doing something kind and nice for them, and you're touching them, and you can see if there's anything wrong too. It's a good time to look at a child's body to see. You were all busy. If you have lots of kids, you're not going to inspect every body every day. You can look for kids if they see if they have any rashes or if they have any bruises or anything like that. It's a good time to inspect them. And the kids, it builds the immune system. So that's a beautiful thing to do. So whether you have a cough or a cold or asthma or not, I do this on my daughter's baby all the time, and she loves it. Because she's a baby that comes home with respiratory stuff every other week. It's just, it's so frustrating. So, but you can really treat persistent coughs, especially, and all the immune stuff, it really gets developed when you're using these techniques. Okay, we talked about herbs a little bit. I don't know. Let's do some specific ones at the end. Okay, Tuina, I was talking about the massage. So you're doing gentle strokes and make sure the child's comfortable, and you want to make sure that it can really knock a cold out of a kid too, because they can start coughing, which is good. If you're stimulating a cough, it helps cough things out, it helps dissolve the phlegm, and it helps dispel the heat in the body too if the baby's hot. So it's a good thing to do after a bath, or if you're trying to cool down a baby who's got a fever. And again, if the baby's got a very high fever, you're going to call your doctor right away to see what to do. You're not going to let a baby develop seizures from having a 40-degree or 105-degree fever. You just can't do that with children, okay? So it's a wonderful way to bond together, and it helps them sleep at night. And sometimes we do this in lieu of acupuncture. Okay, so now I'm going to talk about massage again. What else can I say about that? Okay, we in the office here, we will target specific acupuncture points. So not just along the spine, which is a wonderful thing to do, but we're in the hand and the foot and the head and the scalp. Depending on what the child's issue is, if the child is really, really afraid of needles, I never push it on the child. I have a lot of kids that will take needles. It's really amazing. But a lot won't. It has to do with the fear of needles. So we can do massage instead. And I can use a technique also called Shonishin that I told you about, which is sort of like a rubbing and scraping a little bit, not in a harsh way, but in a way that stimulates the nervous system along a certain meridian and helps kids with everything from improving their eyesight to helping them sleep to building immunity, as I said many times. Okay, I do cupping in my office for almost everybody who walks in the door, but children also enjoy it, and it really helps them a lot. Cupping is a technique that's used in every single culture, and it's a suction cup technique, and it helps bring anything up if there's a pain or if there's something stuck in the system. Chinese medicine says if you have pain, if you have illness, something's stuck. Isn't that a nice, clean, easy way to describe? It sounds oversimplistic, but it really is true. If a kid is having trouble with their shoulder, like in this kid's case, or if the child has had a fever, there's certain points on the back, we can put the cups on and it releases the heat and also stimulate like a massage would do. Little suction cups all over. It doesn't hurt. I wish I forgot to put a picture of my baby, my daughter's baby. I do cupping on her all the time. I forgot her picture. It's a good one. I'll show it next week. But I just wish without her looking, I put little suction cups on her little tiny back. And I can rub it up and down, and it stimulates the nervous system like that Tuina massage does, also a little bit deeper. And also releases the heat, releases toxins so the body can wash it away, let's say, better. And so you pull anything that's stuck in the tissues. When we breathe our air outside, we're breathing in this fumes from the cars, and we're breathing in pollution, and stuff gets stuck in our tissues, and kids too. Kids are much more vulnerable. And to have a treatment where they're pulling this like it's not suctioning it out into the cup because it's just in the skin surface, but it pulls it out enough that it can wash it away to the lymphatic system, and the body can get rid of any toxins a whole lot faster. So cupping is a really fun treatment for babies, children, and adults. People request it every day. I just got a whole new shipment of cups today again from my medicine bomb, the store that I go to order all my stuff. I've been waiting for it because I'm running out of cups because I use them only one time, of course, to keep cleanliness. So I use plastic ones with a little suction gun because it's a little bit safer. There is such a thing as using a fire cup. I don't do that. Never became proficient at it, but I also thought it wouldn't be such a good idea to burn somebody if they never come back to me again. So I'm not going to do that. So anyway, you might want to ask, so why, if my kid is still coughing after, going to the doctor, or my child's even a little bit better now, why should I come to you? Because treatments like this can continue the health pattern going. Instead of going backwards, it can be a good preventative. So if you want to do, I can show you how to do cupping. You can buy your own cups. We'll do a demonstration 1 week on cupping on children and adults, and you can do it on your own kids. And it really helps prevention as well as treatment. Okay, let's talk about my favorite topic, which is acupuncture, obviously. Acupuncture and kids. Like, am I going to stick needles all over your poor little baby, right? Yeah, probably, if they let me. Some kids will and some kids won't, I told you. By the way, children get acupuncture for all kinds of things that we've discussed: constipation, diarrhea, ear infections, eczema, headaches, body pains with body growth. I mentioned this before, but I want you to know that there's almost nothing we can't help with, unless even seizures. I would never take anybody off a seizure medication, but what herbal medicines and acupuncture can do for childhood seizures or even adult, it can help calm the brain down, and it can help calm the person in turn. And the body's overactivity can be slowed down and managed and balanced way better with acupuncture than it can with just medications alone. So I really urge people to look into that, even if a kid's being managed very, very well. I have kids with irritable bowel syndrome, and then things that you would never believe you would hear. But I had a kid one time come in with his mother, and he was 9 years old, and she said, he's got diarrhea. And I said, okay, well, let's see what that is. What's going on with that. He's got a weak constitution. I'm thinking he's not eating the right foods, maybe a sickly kid. And then I said, did you get a medical workup over this? And she said, no, I've never taken him to the doctor. And I said, oh, okay. Well, how long has he had it? She said, he's had it since he's around 3. And at that point, I said, look, if this child, this is not normal, okay, to have diarrhea from the age of 3 until 9. I'm sorry, bedwetting, even all those different things. If you have a problem for many, many years, really, I urge you to check it out medically. And even if they want to do some testing, even if they want to do a colonoscopy for a kid who has irritable bowel or blood in their stool, you have to. How can you say that you've done everything for that child if you don't? You don't want to subject kids to things unnecessarily. So it's a fine balance. But, so I hit people in both directions, people who don't trust Chinese medicine, and I'll never see them in my office, and I could really help. And I also see people who will never take their kids to a doctor. I'm not even talking about the vaccines. I'm talking, they don't even want to see a doctor for their children who have got chronic diarrhea for 5 years or 7 years. It's unacceptable to me. And a mother was a good lady and a nice woman. She cared about her kid very much. She brought him to my office, so I could see she really cared about him and his well-being. But I think she skipped a beat there. I urged her, so she went to I had to check for parasites also. I just think of things sometimes that the doctor doesn't have time to think of. And sure enough, he had parasites. He only had to go on a simple medication. He had a few acupuncture treatments, and he was all better. And I haven't seen him, and he's a grown-up boy now because it was a long time ago. But we could put the body in balance with acupuncture until his body wasn't a setup for that anymore. So that's what we do with the Chinese medicine. It's wonderful. Okay, when we have kids with acupuncture, again, what the acupuncture does, it's actually suitable for babies if they allow it, depending on the age. But we really want to make sure we do is we stimulate certain areas for growth or for building the organ systems, for getting rid of pathogens in the body. Like I was saying with the cupping, you can do needles on the back as well. I've had kids in here for all kinds of things. ADHD, I've treated kids with ADHD, even though they don't sit still. So those kids don't get needles so much because they can't sit still. But we've had them on some herbal medicines, and one kid in particular, we had to say, you have to go on Ritalin because he just was getting kicked out of every single school, and his parents were frustrated that he wouldn't even go to sleep at night and things like that. So sometimes you just have to resort to medications. I'm sorry, that's the reality. If you want to live a bit of a normal life, but I don't believe in jumping to the conclusion of everybody has to be on a medication for ADHD. Now, what we don't like to do is say, go fix your kid. That's terrible. But that's pretty much the philosophy in schools. I went through it myself with 2 out of 3 of my children, so I'm really a believer in trying anything possible to keep that kid sitting in a classroom. I mean, I didn't even try homeschool because I had to do that for a while with one child because it wasn't working out for like 6 months to have that child in school. So in any case, though, it worked great for us, and we were able to do that. Some people just have to work every day. They can't do that. So homeschooling is an amazing alternative if your child is sickly or if your child has ADHD. But let's face it, like people just can't do that. Most people can't. So in any case, though, just know that acupuncture, just like for adults, can treat all childhood diseases. It can treat things that they're unusual things like kids' eyesight. They can help improve their eyesight. There's something called myopia, where the child, it's related to poor function of the organs. And this is what we do in Chinese medicine. We get to the root cause and not just looking at your eye. Let's fix the eye. Looking at your sinuses. We look at what's weak in your body and let's try to strengthen it. It's usually with kids, it's always the organs of the spleen and the kidney and the liver. It's like detoxing sometimes. I would never detox a kid, but we can give them foods to help them eat on a regular basis that will naturally detox, get the liver to work more effectively and more efficiently. Help parents with that too. Lifestyle changes are good. We can pick up on things that sometimes, like I say, the pediatrician might be too in a hurry to be able to evaluate your kid entirely. So you might want to go to somebody like me. I'm just putting a little plug in for myself because I know Western and Eastern medicine. And so I can help you make those decisions of whether or not you really want to spring for going for medicines versus herbs, or trying herbs even though you're on medicines, or trying a couple of acupuncture treatments to see if that helps, whatever the chronic issue would be, or even a new issue. I see kids that out of the blue will have something happening, and the parents, like the kid I told you about, the child that had the ganglion on his wrist, ganglionic cyst. So come and try it out. I mean, again, if it's an emergency, don't come to me. Go to your doctor, go to your nearest pediatric emergency room. Again, you only want to come because traditional Chinese medicine is really not suitable for emergencies. But you do know that we can improve your immune system. We can do a lot of building up the organs. We can strengthen the organs. We can give them great tasting herbs. Just like, for an example, I didn't put this on a slide, but if your child has a lot of respiratory stuff, and you want to give them an ability to improve their immune system. Okay, so you want to give them something in a really flavorful way. They're not going to take it otherwise. Pear juice, black currant juice, any kind of juices that are natural. Go to the health food store, get a good juice that they like, and you can get some powdered herbs and mix it in there. Things that will really help build their immune systems and fight those illnesses that are out there, especially now, the nasal congestion and the runny noses over and over. We can get things for you, like you can get things for your kids like elderberry flower, elderberry syrup, to relieve the common cold and flu symptoms, and even sore throats and fevers. Again, with the fever, don't let them get too high. You have to go to the doctor, call right away if a child's had a fever for more than 12 hours, and it's not going down and you're not cooling them off. But at the same time, if you give them any kind of medication, if it's a low-grade fever, you're not doing them any favors necessarily by giving them Tylenols because the body wants to sweat it out. You want to actually give them something that helps them sweat, like a ginger tea or something. And I know that sounds counterintuitive, but because we've been trained all these years to just reach for the Ecamol. Ecamol in Israel, but Tylenol, and just let them sweat it out because the body's trying to burn it up on its own. And again, watching that fever so it doesn't go over like 38.1, maybe 100, 101, maybe. After that, you have to really pay attention to that fever. So we do know that children, let's just talk about colds before I sign off. They can catch up to 10 colds a year, it says here, and which is more than twice as many as adults are likely experience in a year. But we know it's a normal part of childhood, and we have to just support their immune system. So they're recommending the kids do take vitamin D and vitamin C. It's something you can call me privately for, and maybe next week I'll put a slide up to see how much you can actually give the kids, because everybody's different, goes according to weight. Everybody knows now what something called echinacea. Echinacea is a traditionally used in Western herbal medicine, but we're using it now in Eastern also, and we know it supports the immune system and helps with lung health. And so echinacea, elderberry syrup, those things you can get in your kids pretty easily when they have the flu and the cold and the ear infections. Garlic oil for the ears. There's a lot we can do that's very gentle for them and very natural. So we want to make sure that the body is kept healthy all the time. And we want to just be in touch with that child, when they're sick enough to call a doctor. And if you want to reach me about anything, ask any questions at all, or if you would like to, I'm looking for my stop share. If you want to make an appointment with me, I'll give you a free consultation over the phone, or you can look at my website. It's rbsacupuncture.com. You can send me an email, rbsacupuncture@gmail.com. And it's Yehudis Schamroth, and I hope you have a very happy, healthy week. And don't forget, you can take your kids for Chinese medicine and acupuncture very safely and effectively. I hope this helps. Have a good week, everybody.